Welcome everybody. I'm glad you're still here. Lots of great things going on this afternoon especially. My name is Heidi Kummer and I get to moderate this wonderful session. So first I'd like to introduce you to two people you've already met. Dina Feingold and Deb Gordon, who are co-directors of the Alliance of Professional Health Advocates and Umbra Health Advocacy, and Stephanie Schultz, who's the owner, founder of A Voice for You Patient Advocacy. And they're going to talk to us today about how to make a living as an independent advocate. And we're very much looking forward to this. So without further ado, please take it away.
Thank you. Oh, do you want that? Or are you gonna?
No, you go ahead.
We need to share. Yeah, we'll share. Hello, everyone. Thank you for coming. Thank you for staying if you were here for the last session, and thank you for coming. I am Deb Gordon. As Heidi said, I'm the co-director of the Alliance of Professional Health Advocates and the co-founder of Umbra Health Advocacy. You can see the incredible credentials and experiences of Dina and Steph. They're the stars of this particular show, so I'm going to just sort of facilitate and give some context. I'm not going to read their bios because you probably know them and you can talk to them after. So I'm going to speak very briefly for context. This is like, I once heard talking to the Pope about Catholicism or something like this. You know, this is, we all know this in this room, that healthcare is hard and it's getting harder. So just like infinite data points and statistics about how complicated healthcare is. The PAN Foundation has done an annual report on the state of patient access, and they give overall access a C, which is not good. If I came home with a C, I would have very disappointed parents. And they're just, I would say, I don't even, it just, healthcare is confusing. Most people don't understand their benefits and their insurance coverage. Almost everyone wishes benefits would be, that insurers would have to be more clear about their benefits or about the rules and coverage policies and decisions. And most people are confused. I think, again, like Captain Obvious here. My job is Captain Obvious. Healthcare is expensive. Most people, more than half of Americans either can't afford their healthcare or worry about not being able to afford their healthcare. About 1 in 5 to a quarter skip filling a prescription or skip a medical procedure because of cost. And there's a lot of data that suggests even just fear or anxiety about cost keeps people from getting the care that they need. That's not good when people skip the care that they need, even if it's covered. There are significant, sort of take all this together, there are significant systemic or system-wide impacts of cost and confusion. I think Accenture estimates that health system complexity costs $10 billion a year. That's in like stupid wasted administrative expenses. Clinical waste due to lack of care coordination costs between, it's hard to quantify, but between $30 and $80 billion a year. And this really pains me, but the people who least understand their health, are least health insurance literate, tend to spend too much on their benefits. They overbuy benefits. And so it's sort of like a tax on confusion. That if you're not fully literate in health insurance, and really who is, most people are not, you tend to sort of buy more than you need and skip care when you need it. And there's a lot of data. I have a library on my laptop if anyone wants more data. But the point is, healthcare is hard and getting harder. So, there are advocates of different ilks here. We at the Alliance of Professional Health Advocates focus on serving and supporting independent patient advocates. Now, we know that anyone who calls themselves or functions as a patient advocate is very most likely doing the best work possible with the best of intentions, and we don't want to say otherwise. However, there are financial incentives that can interfere with that purity of purpose or purity of mission, unless someone is being paid by the patient or an agent of a representative of the patient. So we stand for the allegiance factor, where there is nothing in between the patient's best interests and the advocate's work, that independent advocates work only and solely and exclusively for the patient's best interest. I'm talking fast because I want you guys to hear from Steph and Dina. This conference is evidence to, just one piece of evidence to the idea that the market is catching on, that we're not alone in, understanding the value of advocacy services. These numbers just show the market is big and growing for both clinical and financial advocacy services. And we expect the rise or growth in our industry just to continue. Okay, that's great. What does that mean for you all who are or want to be independent patient advocates? So there's a lot of need, there's a lot of confusion, and the market looks like it's growing. So let's now translate that into real-world, practical, day-to-day implications. How can you as an independent advocate turn all that market need out there into a thriving, lucrative, or whatever supportive independent practice? Okay, that's where I now hand it over. Can you ask a question?
Yeah, I want to ask a question.
Sure. Of the audience.
Of the audience, yeah. Sorry, I'm going to go rogue. I'm going to go off slide for a second. Just by show of hands, the people here, how many of you are independent patient advocates looking to, okay, great. And then how many of you are employed currently with organizations in patient advocacy? Wonderful. Okay, good. How many of you are looking to build your practice and looking for tips and, okay, terrific. Okay, so we're going to speak to that. What's that? Dibs?
Everybody that just wanted to dibs.
Oh.
Next hiring.
Okay, good. Okay, so we're going to carry on, but I just wanted to get a sense of who our audience is. I know we're all a part of this conference and wanting to take away something, a nugget from each presentation. So just want to get a better understanding of who we're speaking to and what we're speaking about, and making sure that it resonates with you all. Thank you. Okay, back to Deb. Steph.
I was going to go rogue and ask the same question.
Oh,
so we had another mind meld. So basically, thank you all for being here. And I love that there are so many independent patient advocates. And, many times when you're starting, and I'm going rogue because I'm not really following a lot of my, required speaking notes here, but these are the questions we're going to talk about today, and really that are hot topics for how to know to get started. So we're going to go through these in detail. First of all, when you're just starting out, and I'm sorry, I'm not used to using a microphone. Did you just skip through? Okay. Yeah. So if you're just starting out and you're thinking about your practice, and you really need to think about what are your goals, right? So what do you want to do with your business? What are your goals? What are your priorities? Where are you going to go with this? And I wish I could see the slide better, but having how much do you need to earn? Oh, you got one. Thank you. Except for I don't have my reading glasses on. I'm at that age. I'm just getting help from everybody. See, we are in a room full of advocates. So really, how much do you need to earn? That's one of the biggest questions, I think, that when I talk with new advocates and they're coming on board and they're taking some classes with us or whatever, it's how much, can I really earn the amount of money I need? Well, that answer is different for everybody. What you need to earn could be based on the fact that this needs to replace an income, or whether or not this is going to supplement your income. So that's going to be one of the first questions to really help define where your path is going to go. Are you going to be trying to achieve this as your second career? Some of us are doing that. And so your philosophy is this intention, and should you, this is obviously a hot topic, right? Like, how much of this do we feel like we can charge, or do we want to charge? And what's our philosophy behind charging people? And sometimes that can be a really hard thing for us because we have such big hearts in our charity. Sometimes we also need to think that we need to pay our bills too, right? So it can really persuade how you move forward in your advocacy practice. And I kind of already jumped ahead with, with your priorities. Are you trying to, optimize your income, just pay your bills? Do you want to scrape by? Probably not. And focus on, basically with, the what you're trying to achieve. I'm totally at a loss for what I'm trying to say. How much do who you serve do you want to have matter? So basically, when you're getting, I didn't write that sentence, so I'm actually drawing a blank on that.
On which one, focus?
Yes.
So, yeah, I think what we're just trying to say here is that some people are called to serve, to do advocacy as a calling, or we have advocates in the Alliance who do advocacy pro bono. And then we have advocates who charge for every 15 minutes, and both are, and everything in between is valid. I think the point to these slides is just that your practice should start, the design of your practice needs to start with your own goals and priorities and philosophy. What do I want any hour I spend doing advocacy work to be at a certain value or reimbursement level? Or do I want to help as many people as I can? Those might lead you to different kinds of practice, that's all.
Well, and then the next part with the capacity, this is such a giant question because, again, we have big hearts, and I literally get phone calls from people that I don't want to say no to. And how do you determine what your capacity is? And it's the most daunting question. And I remember starting out, and many of you received this question from me. Well, how many clients can I take or should I take? What's the right answer? There's no right answer, right? So your capacity on that is going to be determined by many factors. One is going to be determined on how much money you need to make. That's one, because we've established that. But also what type of work you do. Are you going to be putting yourself out there for a client 24/7, or are you on a project basis? So there's just too many questions. If you ask, well, how many clients can I take? That answer is different for every single person.
Can I just also speak to that? So I think with a lot of us who are starting out, or maybe who are new to advocacy, and we do want to help a lot of people, I think when you're just starting out, you think, I'm just going to take on this client. I'm not going to charge them for it because I'm new and I need to have the experience. And that sort of scaffolds up into, well, I'm still new, so I don't need to charge, or maybe I can discount my rate. And we'll speak to value in the next few slides, but just think about that, because you don't want to establish, and I don't want to tell you what to do, but I think we all sort of fall into that, like establishing, well, I'm new, and because of that, perhaps I don't have to charge my rate. So just something to think about for the folks who are new, or new to advocacy, or new into billing clients, to maintain your value and definitely charge what you're worth, because you have expertise that they are paying you for and that you have. Okay, next.
Segue to the next slide.
Yes.
Your expertise.
Your expertise.
Okay, go ahead. So, some of us are coming from obviously many, many different backgrounds. So we may have already kind of predetermined in our head whether we've done worksheets or cost analysis or, surveys amongst where you live. It's going to matter geographically where you live. It's going to matter what you offer for services. So what is your expertise going to bring to your clients, right? So my background is different than your background and the person sitting next to you. So we have some people who come from being a patient themselves. We have people who are caregivers. They took care of their family and they now want to pursue this role. And we have those of you who are clinicians, and we've got MDs who do this work, and we have therapists who do this work. And so it can be very intimidating, right, for those people who come into this world and they're not a nurse or they're not a doctor, because they're joining the ranks of people who have such a wide array of experiences. And I always try to tell everybody, it doesn't matter what your background is, you come with an experience that can help somebody, right? So don't downplay your experiences and what you can do to help people. Is there anything you wanted to add to that? Go ahead. We're kind of just playing it by ear and jumping in. So, okay, so like looking at who we're going to serve, you know, who's our target audience, and that's really going to be coming from where our experiences have come from. So, you know, my background, as you can see, I have therapy background, I have extensive pharmacy background, and at the same time, like, I thought I knew what I was going to work on, and it ended up being a little bit different than I thought, right? So even though you may have a target audience, I just want to point out, like, it can change a little bit. You know, it couldn't be what you didn't expect, and it could be based on what you didn't realize you were even good at. So I want to throw that out there. But, you know, determining your audience based on where you live, what the need is out there, and, you know, if you're going to work with children or if you're going to work with the older adult population, there's so much to consider when you're deciding kind of who you want to work with, because, you know, if you're working with children, you're also working with their parents, right? If you're working with older adults, you're often working with their children. So your techniques have to be honed in on not just for your client, but for their caregivers, right? And so knowing your audience is not just knowing your client audience, it's also, in my opinion, knowing your support system audience, if that makes sense. Okay, so how are we gonna see them? Okay, so this is a big one, because COVID obviously taught us a lot about how to work virtually, and that is, you know, a silver lining, that it created a way for us to develop a method to work with people, and they've kind of gotten used to the ability to do Zoom that never would have even been considered before. And I think it's bringing advocacy to people who would not have had it otherwise, right? So travel expenses have to be considered when you're thinking, you know, in person is obviously wonderful for many purposes, but it doesn't fit everybody because it increases your cost. And, you know, you don't necessarily want to eat the cost of the transportation time, but you also don't want to have to pass that cost. So sometimes the answer is working virtually. And it may not be ideal for certain situations. So those of you who may be working in billing, you don't necessarily need to lay eyes on the person you're working with, but if you're working on a potential concern in a nursing home that there could be some, you know, mistreatment, you want to lay eyes on that person, right? So there's a big difference based on the type of client you decide to work with as to whether or not you find it a better fit to work virtually or whether it's to work in person. And I think that becomes a real personal choice for you. You know, we all have our opinions on that, and I do both. And sometimes I work with clients in person and virtually, just because sometimes the extra support they need doesn't mean I need to go see them, but sometimes they really do want that visit. And so if you have the flexibility to do it, that could be a great option for you, but it's not required. Oh, solo practice versus affiliates. Okay. So the part about working by yourself, so again, I'm going to bring back, it's going to depend on the type of work, but I can tell you from my experiences, I find that, and I have such a fabulous team of people, right? My community means the world to me. And building yourself up, and I'm crying because there's such great people. And they're all here, and I think if you can build yourself up and build up your network and your community, it's going to strengthen your services. Yep. And that's like, it's so serious. And you can totally be independent, 100% be independent. And I didn't know when I first started that I was even going to grow a team. It just happened because there are good people out there, like you, all of you. I'm sorry. I'm
No,
a
that's
mess.
great. No, you're perfect.
Guys, seriously, the hallway building rapport is like the best thing about these conferences, and I just like I can't get enough of it. So all of you, to like building your team and building your support is going to just help you so much. So yes, you can do this independently. Did I get tears from someone back there? So I have gone through. I'm going to call you out, Nancy. So I've gone through a lot of steps to prepare myself where I felt, because I will admit, I had, and I'm going rogue, I'm sorry, I had a, I don't, like imposter syndrome. How many of you have felt that you have an imposter syndrome, right?
Same, yeah.
Like, what? Okay, my tag says speaker, really? Because why me? And I feel like maybe it's because I'm representing the same feelings you all have. Maybe not. Maybe you all just think I'm a blubbering mess, right? But at the same time, like I build myself up, I build up my network, I do a ton of research, I overthink everything, and I take classes, and I take the boot camp or the 100 Days Academy, and I still to this day have friendships that I've built in that 100 Days Academy, and they're here. And so building yourself up and growing with people is just so fantastic. And I love that there are so many advocates who have been doing this for so long that welcome the new advocates. And I feel like that is our duty, is to continue to bring on those new advocates and build them up with us.
I can't add to that. Good stuff, yeah. Teamwork,
Teamwork makes the dream work.
yes.
Okay.
Okay,
Dina's turn.
yes. Where are we at? Oh, focus, paradox. Yeah,
Do
go
I need to
ahead.
take over this thing here?
It's a train wreck.
No, it's
No,
beautiful,
that's good.
actually. It is such heartfelt work, and thank you for, I mean, this is why you're busy. This is why clients love you and insist it can only be you. The purpose, the stated purpose of this session is actually how to make a living. I think Stephanie's...
You make a living by building your community.
And I think that what Steph is showing is that it is a deeply personal set of decisions and set of actions that you get to choose to take. Dina and I, we talked to, I feel like hundreds of advocates. I actually don't fact check me, I don't know if that is accurate, but dozens, feels like hundreds over several years now. And we hear from lots of new and seasoned advocates and everyone in between. And we also work really hard to market your services to the public and try to connect independent advocates with clients. So we can say that all these decision points that Steph has laid out, like how are you going to work and with whom and for whom and what are you going to do, kind of point to a focus. Are you going to focus in on a population, a disease state, a geography? And what we've learned is that it's a very delicate balance between being narrow enough to communicate your value and your services to the market, and being broad enough or flexible enough to accept who comes in. That you might think you're going to this is, I think you were saying, Steph, you might think you're going to serve one clientele, and then your phone rings, and you got to decide, are you going to say yes or no? They may or may not fit that bill. Dina has a story about that you want to share.
So before I became the co-director of AFA, am I too loud? It's like,
What's louder than this?
I don't need a microphone, I'll just stand here, take this. I'll go all Ellen on you. Or Oprah. So before I became an independent patient advocate, before I became the co-director of AFA with Deb, I was an independent patient advocate. And I used my personal experience to tailor what my practice was going to be. And because I had a child who was born with a rare disease, my practice, my focus was going to be the pediatric population of children with rare diseases. I was like, that's perfect because it's an inch wide and a mile deep, and I know who I'm going to focus on. I know how I'm going to target these people. I did the AFA 100 Days to Launch Your Practice program, and my phone was ringing before I even hung up my shingle. But people were not calling me about pediatrics. They were calling me with their adult children, or they were calling me about an insurance issue, or they were calling me for a second opinion even to come speak at a health insurance conference, how to get coverage for rare disease. And I told every single person, I'm sorry, I can't help you. I only focus on children. My focus is pediatrics and rare disease, and you don't fit into that, so that's not going to work. But I can refer you to somebody because I'm a member of this great organization, and I have a laundry list of referrals who I can refer you to. And then I got another call from a a rabbi at our local temple, and he said, again, same thing. Can you come see this patient? I need you to come see her bedside. Her family doesn't live here, and she needs to have an advocate help her navigate the system and get care. And I was like, well, how old is she? Is she a kid? No, she's an adult. She's a grandmother. She needs help. I was like, oh, I'm sorry. She doesn't fit into my box. And then, okay, so that kept going and going and going. And then I realized, dummy, change your focus. Maybe you shouldn't be so narrow and tight. You can open it up and perhaps focus on some of these folks that have adult children who do need help. And that's sort of when something clicked, and I thought, I don't need to be so tightly focused on just this one population of individuals. I can still do the same thing that I was going to do with these kids and their parents, but I could do it for the adults too. So as it turns out, parents have big mouths, and they didn't really need me after all. So I was able to shift my focus, and that's the point, is that you want to, if you are very focused on just one particular population, like say rare disease, consider going cancer, or consider, if you're focusing on second opinions or researching physicians, it's great to have a niche, but the point is, be flexible in theory and flexible in thought when it comes to your population.
One thing I just want to add to that is that we also see advocates who are like, I can do all of it. We're like, awesome, we believe you, we know you can, of course you can. It's actually harder to market that broader set of services. So you might have a harder time finding the rare disease, pediatric client, but it's much more clear and facilitates kind of marketing and publicizing your services. When we have advocates who are like, I can do any care navigation whatsoever, it's actually great because you can help more people with that broad, adaptability or flexibility. But it can be much harder to sell your services. And so this is the paradox or the conundrum. And we're not here to say do it one way or another. We're here to say, just understand this tension between how you message yourself and who actually needs you, and best to sort of listen to the signals you're getting from the market. If you're not busy enough, are you too tightly focused or too broadly communicating, and you might want to adjust the dial up or down in one direction. And that is the point. The message of this talk is there's no one answer, but these are the questions.
Yeah. So moving on to how are you going to reach prospective clients? So establishing an online presence, directory listings, website, social media, you can see everything that's up here. The point is that you don't have to, you want to do it all, but you want to focus on who you're trying to reach and what you're offering, and you need to think about the marketing, because it's not enough to just hang your shingle and and join a Facebook group. It's important to connect. You could list yourself in different directories. You can actively post on social media. You might attend local events. I know Steph does a lot of public speaking and participates
Yeah, I don't usually cry, though. I'm on camera.
You might be in the supermarket, you could be at sports games. What I found when I was starting out and then continuing to practice is that having organic conversations about who you are and what you do, it always resonates with folks that you're talking to. And maybe not in that particular moment, but down the road, because they'll remember, oh, I'm bumping into a healthcare issue. Just today, I didn't even tell you this, just today, this afternoon, I got a call from a friend who, by the way, I have a referral if anybody needs help, a client rather. She called me because she's like, I need somebody, my mom's been diagnosed with stage 4 ovarian cancer. I need help with somebody, I need somebody to go through my mom's bills and who's meticulous about insurance billing. And she had just remembered that, you know, this was a diagnosis that happened in June, and I'm just connecting with her today. But she reached out today, and I thought, that's so neat. It's just a few months later, and we happen to be walking, and we happen to be out talking, and just having that conversation. So it seems like, you know, pretty simple, but it's important to tell people who you are and what you do, no matter where you're at, on the sidelines of a sports game, buying bread or milk, or speaking at, you know, some event. Next. What can you charge? You're the money honey.
Okay. I think it's not like an insult.
No, it's
right?
a good thing.
Not in this session, we're talking about money. So here are the money slides. So, you know, as I said, we talked to whoops. Uh-oh, that's the clicker. No. Thank you. We talked to a lot of advocates across the whole country, across specialties, across service areas, across niche and focus areas. And, you know, what we've learned, what we know, is that it's not a simple question like, what can you charge? We also know that there's kind of rules of thumb out there. You do a calculation, you figure out what your hourly rate should be, and that should be your rate. That is great, and it is a good place to start. What do you feel your services are worth? But I forgot to say that you're an economist, Nick, from the last session, but like, this is what I know about economics. It's the only thing I know about economics. Actually, the market tells us what we're worth. That's not a nice way of saying it. Like, we think you're all worth a lot, obviously. But your market, your niche, your geography, your focus area, your service area, what will people pay for your services? That's what you can charge. You can set a rate that feels worthy of you, and if people will pay that rate, you're right. And you might try to go up, or you might sometimes go down for a particular case or particular person. If you set a rate and nobody is paying it, that might not be a problem with the rate. It might be a problem with the messaging or the marketing or what have you. But it might be that you've missed the market. And there's nothing wrong with that. It's just, that's the reality. So people actually, new advocates often ask us, what can I charge? And we're like, no. Only you know like what you feel you're worth, and we don't like to tell you. We can tell you it's definitely easier to sell an hour that's less expensive than one that's more expensive. But that doesn't mean we can't sell or you can't sell a more expensive hour. It just, you know, you can reach more people with lower rates. That's not the right answer. It's just, you know, one of our observations. And the reason we went through sort of all the, you know, positioning or practice focus questions to consider is those things will determine what you can charge. Who is your target audience? What can they afford? What are their alternatives? Where are you? What are the costs and sort of going rates in your market? And then, you know, do they have alternatives that are free? That's really, really hard to compete with. Do they have no alternative? Do they have resources? Do they not have resources? These are the factors that determine what you can charge. And then your own capacity. We have so many advocates, and those of you who are starting out, hopefully you'll find I want to say solace, but I can't. But, maybe you'll find sort of support or inspiration in this idea. But we have advocates who start off at one rate, and then we come back to them and they're like, my rate is now higher. Lots of people have done that and informed us of, an increase in rates. And we're like, that's great. That means you're busy. That means you can't, you're occupied. Too many people were, right? This is economics, right, Nick? Like too many people were willing to pay at your lower rate, and that you've got overloaded, so you raise your rate a little bit, and it sort of evens out the demand. That's a really good thing. That happens a lot, but you're kind of letting the market tell you when you're there. Yeah. And that's about, your own capacity might help you set, okay, I'm not actually busy right now. I used to charge this and it's slow. I'll take a client for less. Okay, wait, now I'm super busy. I'm gonna go back to raising how am I doing on the economics? Not very good, but thank you.
No, it's good. You get the whole possibilities, production frontier, certain price, you're gonna get, at a higher price, you're gonna get fewer people.
Yeah, this is an economics lesson taught by a business person.
There's a really good book called Book Yourself Solid.
Book Yourself Solid. Okay, Nick Starling recommends Book Yourself Solid. And so let's actually talk about money. We literally see rates from $70 an hour to $400 an hour. And there is not a ton of correlation between who's charging what. The strongest correlate we can see is geography. So if you're on a coast, if you're in a major metro, LA, New York, those markets, San Francisco, you can charge a lot more. People are used to paying more for everything. If you're in the middle of the country, it's harder. That's just a lower cost of living kind of place. It doesn't mean that an advocate in the middle of the country isn't worth as much. It's just the market does not have the capacity for those higher rates. So where are you? What are your credentials? We see MDs and PhDs at these upper ends of the range and in the middle. There's no right answer. It's really personal. It's really based on this combination of factors and what feels right to you. We know advocates who have been in practice or in business or in their specialty for 30 years, and they will not charge more than $95 an hour because that's just what they do. Okay, you probably could charge more, but they don't want to. And we say, that's fine, that's great, you do you. That is the whole point. There is no right answer. There are some advocates who, and advocates who from time to time get creative. So a project rate or a performance-based compensation, especially in billing, some people will take a piece of the savings, others will not. Again, it's all good, but there are not just hourly rates and retainers. There are a really wide range of ways to think about compensation. And I think I said this already, but I'm going to say it again because I think it's really important. What you think your rate is or should be, you may need to adjust it up or down depending on your own capacity and the market response to your fees. And even that is not going to always be the same. So even within your own career, you might find that shifting over time, up and down, up or down. I'm pressing the wrong button. So just one more point about the market concept. So I started this presentation with a lot of statistics that are meant to convey the need for independent patient advocates or for advocates. Healthcare is hard, complicated, expensive, and people are confused and need help. That is not the same as market demand. Also economics. That the need is not the same as the willingness to pay. So what we want to say is sort of think about the need. Where can you be of greatest value? Where can you help the most? But your actual market is, you have to hone in until you get to not just who needs you, but who can find you, who can pay you, and who is ready to I would say take out their checkbook, but that would make me sound wicked old. That's not what people do anymore. Who's willing to pay you and ready?
Apple Pay.
What? Apple Pay. I've heard of Apple Pay, thank you. So we have, Heidi, we have 10 minutes. So what? Yeah. So I'd like to actually hand it over to Q&A. So we have these two, either current or former practicing advocates here. And like Stephanie is so busy that we're so lucky she made time for this. But she started only a few years ago. And so I think, and Dina also, as she said, started getting calls before she even was ready. So what can these guys answer for you about their experience, or what can Dina and I answer for you about our observations from the Alliance and the marketplace?
How did clients find us? I have to be completely honest, just about every single one of the people that I work with are brought to me through word of mouth referrals. It has come from building my team and my network and my referral system and the contacts throughout the community that I live in. Some of the ones that I do virtually have come through, different types of directories or membership organizations like AFA or GNA or NAC and, all of them. So I take, it depends on kind of where your focus is, really, on what you're going to drive as far as your biggest referral source. But mine, personally, for the type of work that I do, mostly comes from word of mouth, building those relationships in the community with the social workers at senior centers, from doing speaking engagements, just meeting at support groups for people. Many people have heard me say this. Just last week, I was asked to speak at a Parkinson's support group. Before I even got to my driveway, my phone already rang from that group, right? So it's just being available and letting people see you, and they love that education. That's our give, right? That's what we do, is go out to teach the community and give them the resources that they just don't know how to find, and that's the connection, and then they call you back. That's one simple answer, but it's not simple. I call my team the other advocates. I have, there's 6 of us from Wisconsin here right now, and we have all referred to people, collaborated. You build these people of collaboration, not even local. They can be virtual. There's many people here that I have called out of state who just because I've Barbara, who was just on stage right before me. I've called her about things. I mean, I could call out literally every person here, right, that I've had conversations with. Gail, I just talked to you last week because I have a family who wants someone in a different state, right? So if you network enough in places like this, you're building those bonds that you're creating and you're starting virtually. So to see these people in real life 3D, and then that's my team. You all are literally my team. But I have a local group of people that I tend to, they're everywhere. We literally talk every week. And it's just building your network, and that's my team. So I don't have employees. I don't have employees, and I don't intend to have employees. Subcontractors, collaborators, people that you can bounce ideas off of, share cases with, who can fill in for you. The type of work I do, I work with older adults. And just for one example, I had someone here who we shared an ER visit because it was already 10 hours for her being there that I was like, snowstorm, really, you need to go home. I went, relieved her. I was there then until 2 in the morning? I don't remember. But you can't do some of these things alone. You can't sustain it alone, right? So you need people in your corner, and that's what I call my team.
Thank you. Thank you so much for this. This is fabulous. I can feel the passion in the room, but also on the panel. So thank you so, so very much for inspiring all of us. Couple of things that I would love for you to comment on. I just became board certified as a patient advocate. I started working with AMRA and AFA. So excited to take the 100-day course. I've been so busy, again, just by word of mouth, that I haven't had a chance to really think about the logistics, paperwork, waivers, contracts, websites. I honestly haven't had a chance to do all this. I'm starting the 100-day course on September 10th, and I'm very excited, but if...
I'm like, hi, I don't even have the list yet.
What's that? I'm sorry. So if you could just give me a couple of tips on what I need to do versus what must be done as an advocate, that would be great. Thank you.
That's a good question. No, you go ahead because...
Oh, well, okay. Well, one, it's nice to know that you're going to be in the course. I didn't know that. So there is definitely a must-have list and it would be nice to have list, right? So like you need to have your documents. You need to have something people can sign. You need to have your agreements and your releases and all those forms, right? In order to make sure that you're properly working, legally. But insurance, the errors and omissions and liability insurance for your business. So if you're a healthcare worker or a clinician of some kind, they often continue their nursing, their insurance through those types of organizations. Those of us who don't have a license currently, it's a little different on how you get your insurance. So like those are things that you definitely want to have covered. Can you work without a client management software? Yes, you can. There's many of us out here who do. Sometimes it's a wish list. You don't have to have it, but it can make your life a lot easier. You can use Excel sheets and Google Docs and all of that and make it work. So like you don't have to have that. Depending on what kind of payment system you want. How are you going to accept payment? Do you need to have a way to process credit cards? No, because you could just say I only accept checks or, whatever. So there are things like that you can be creative with, but it can also make it, let's say someone's interviewing you and another advocate and they find that they have a portal that allows communication, but this advocate doesn't and they really like that, right? So it could come down to maybe you want it just because it could be part of the interview process and what they like to work with, and if they feel more secure having a portal that you can communicate through. So then in that side, you may think it is needed, or they like to use credit cards, so then you might think it is needed. I have a credit card system and I have to be honest, I've never used it. Everybody sends me a check, even the people who are virtual, they like sending checks. I'm like, that's fine with me. Do you want a post office box? Because do you want people to know your home address? Right, so those are, unless you have an office somewhere, so those are just things that you have to kind of consider, like the list of things that you need for your business and really what do you feel you need to either be competitive or to be efficient, if that makes sense.
All of that is correct, but getting an LLC first.
Oh, yeah, well, yes, thank you. Thank you, Michael.
Hi, thank you. This has been incredibly helpful. I'm over here.
Oh, there you are. I was like, where?
My question is for those of us, I was going to say those of us that have been doing it longer, but actually based on those of you that have said you're super busy right out the gate, this may be applicable to everyone. But with regard to subcontractors, when you get to that point where you've reached your capacity, but you want to grow, and as you said, Stephanie, not like hire an employee, logistically, how does that work in terms of contracts and insurance? So specifically, does that client have a contract with you and the subcontractor? And then the second part of that is, does that subcontractor need their own LLC and their own insurance, or are they working under the auspices of your LLC?
Really, really great question. And when I first started, those were the questions I had. And I reached out to so many people to figure all this out. And it depends. You can do it both ways. So one of my colleagues that's here with me today, we literally co-sign. She has her own LLC, her own business, her own insurance. We co-sign almost every one of our clients together because that's what works for us. However, some people think, well, you're just missing the boat. You're not getting the money, or part of the money that she bills. I don't care. That's not what I'm doing it for. Some people, if you want to be more business savvy, you may set it up as a subcontractor, and you may or may not cover the insurance. Like if you work through Umbra, as a subcontractor, you're covered under the Umbra's insurance. Other independent advocates, you would have most often your own insurance and you subcontract, because most often you are also running your own business anyway. So most often you're going to have, like, I know there's advocates out here who are posted on multiple advocacy websites, right? Because they do work with so many other companies, because they don't want to have a billing specialist always, so that person can be a billing specialist for multiple companies. So you can, most often you have your own insurance, and you sign a subcontracting agreement so that you set up the parameters of, you know, who does the client belong to, right? And then you, as the client's engagement, you're the face of it, and this work is done behind, unless you're patient facing and you do switch people out, and that happens like we do. So it really just depends on what works for you. You can do it both ways.
I hate to do this, but we are out of time, and there are other sessions that are following in just about 5 minutes. So I know Deb, Dina, and Stephanie are going to be around. If you have questions, I'm sure they're happy to answer them in the hallways. Thank you very much. Thanks everybody for the session. And